This week on Empowering Midlife Wellness, we're continuing our series celebrating Menopause Awareness Month, talking about nuances regarding menopausal hormone therapy. And this week we'll talk about some nuances regarding testosterone for women coming up. Hi friends, and welcome to this week's episode. If you're just joining me, I'm Dr. Susan. I'm a board-certified gynecologist and certified menopause practitioner dedicated to taking care of women in midlife. Women just like me who want to feel great now and also feel great as we age. So remember, this month is Menopause Awareness Month, and this past 3 weeks, I've been posting short episodes with some nuances about menopausal hormone therapy because you all are so educated that now we're kind of getting into some nitty-gritty details. So the first section was about a question regarding estradiol during perimenopause. Last week, we talked about progesterone. Do you need it if you've had a hysterectomy? This week, I'm going to touch on the third hormone that's very important, which is testosterone. We've talked a lot about that before. Testosterone still is the most controversial of the 3 hormones just because of this old idea that it's a male hormone. Most of you know by now that it is not a male hormone. We both have testosterone, men and women, just like men and women both have estradiol, but in very different levels. So women typically have about 1/10 of the testosterone of a man of a similar age. An interesting fun fact we've talked about before is that we make much more testosterone throughout our lives than estradiol as women, which is very interesting. We might miss that because the units of measurement are totally different. So the number on paper looks like estradiol's higher, but in fact, because the units of measurement, you'd actually have to divide it by 10 to be an apples-to-apples comparison. So suffice to say, we make lots of testosterone throughout our lives. It drops slowly as we get towards menopause. Now, some women do produce some testosterone after menopause, but it's almost always very low, frequently even 0. Now, who cares about that? Well, I do, because when my testosterone was 0, I completely lost my sex drive. So the main thing that testosterone's been studied for is improvement of sex drive. So the question that I'm answering today is whether testosterone has been proven in any studies to help with anything for women, and the answer is yes, it has. There have been some very good, what we call randomized controlled trials. That's the kind that doctors think are valid, where there's a group that takes the active medicine and a group that takes a placebo. Neither one knows which one they're taking, and then they're followed over time. So testosterone has been studied in randomized controlled trials for improvement of sex drive, and it does improve sex drive better than placebo. So many of us who've taken that have experienced that firsthand. I certainly did. My sex drive was 0 when my testosterone was 0, and it rapidly improved within a couple of weeks after taking an appropriate dose of testosterone for a female. So now other things can be improved too, but have not been studied in these high-level studies. But we know from anecdotal evidence and some smaller studies that testosterone does help with muscle conservation, bone health. Many women say mood, energy, sleep. So yes, it is helpful for women to take testosterone. Now, low sex drive has a fancy name. We call it Hypoactive Sexual Desire Disorder, just so we like to give things fancy names for insurance coverage and things like that. So to find out whether you have that, I just ask 3 questions. Did your sex drive used to be better? Do you wish it was better? And is it causing you a problem? Like, does it cause a problem with your relationship, or you just don't feel good about it? So most patients answer yes to all 3, and therefore taking testosterone in the appropriate amount for a woman is something to consider in perimenopause and menopause whenever we have measured that it's low. Second part of the question is, do you need to measure it? And my answer is absolutely yes, because if it's not low, then I wouldn't treat you. Now, remember I said the units of measurement are different for all 3 hormones. Now, testosterone doesn't really matter to you. I know what the measurement units are, but typically we want to be at levels that young women have. At least that's my goal. So somewhere from 50 to 100. 50 to 100, and that's in nanograms per deciliter if you care, but that's the number that you'll look on a piece of paper. Now, if we measure your testosterone and it's already 65, I wouldn't treat you. We could say in that case, you do not have low testosterone, so let's look for a different reason for the problem that you're presenting with. So I think it's very important to measure it. A woman with a testosterone of 65 is going to need a very different treatment than one who has a testosterone of 0, for example. Or more specifically, a woman with a testosterone of 30 is going to need less than a woman who has 0. So you can see that it does make sense. And then I also think it's very important to measure it after we give you testosterone to make sure it doesn't get too high. It's very true that if we get too much testosterone, we will have adverse side effects, just like too much of anything. So I always say the dose is the poison. Testosterone is fantastic, but too much of anything is not a good thing. So when it gets significantly over 100 for a long time, not in a week or two, but prolonged months, we can get masculinizing symptoms like hair growth on our chin, hair loss on our head, deepening of our voice, Adam's apple, clitoromegaly, oily skin. We don't want those things. We don't usually check our testosterone when we're in our 20s, but I'll tell you a funny story. I have a daughter who's 20. In fact, I have 2 of them. I have twins. She was having some blood work done for a different reason, and she did the panel that we do at our office that happens to include testosterone, and she's a very, very healthy young 20-year-old, and her testosterone was 62, and I just thought that was cool because I'm like, yeah, good for her. My testosterone's about the same because I take it. Now, do we know what dose to give? This is a multi-part question, I know, and the answer is yes, because there have been many studies done on testosterone for women. In fact, in other very civilized countries like Australia, it's government approved. We don't have that here yet for lots of reasons that are too long to get into here. However, we do not have FDA-approved testosterone for women yet, not because it's bad, just because we haven't got around to it, and I promised you lots of people are working on making that happen because men have way more than 10 forms of FDA-approved testosterone. However, let's just go with Australia, a very civilized country. There, they tell their patients to use 5 milligrams or 10 milligrams in the form of a topical gel. Instructions would be try 5 if you want to go up to 10. So just to say, there's a big range that's safe. So typically, we would start our patients on 5 milligrams a day. That is a low dose. Furthermore, I like dividing it up. 2.5 milligrams morning and night, because that gives you a more stable level if you're using a topical cream or a gel. There's lots of other ways to get it that we've talked about before. You can put a little thing called a troche under your tongue. We don't want you to swallow a pill. Some people put little drops under their tongue. You can also put a pellet under your skin. I promise you that's very safe. Again, it has to be dosed properly. In the end, 6 weeks after you start treatment, we want your level to be in that 50 to 100 range. In that range, you are going to optimize the benefit for sex drive, as well as muscle conservation, bone health, without having any side effects. So lots of nuances there about my very favorite hormone, testosterone. It's hard to put them in order, but I really love that one. So many benefits for us as women, and so underappreciated and misunderstood. So putting it all together, yes, testosterone has been tested for women, primarily for improvement of sex drive. It does have some other benefits as well. Yes, we do know what dose to give. Yes, we do know what dose we're looking for, which is within physiologic range for women. We don't want it to be 200, 300. That is not safe. And if any of you look at some previous videos I've made before where I gave different recommendations for higher numbers, I've changed my mind. I've learned we do not want it to be 150. Yes, I did say that. Now I want it to be 100 or lower, and mine is around 70. I feel great. So over time, with my own personal body, I have dropped my own testosterone. I feel equally well at 70 that I did at 150, and I don't have little hairs on my chin, and I'm not worried about developing other symptoms as I continue on it for the rest of my life. So now you know much, much more than your doctor about testosterone. If you enjoyed this episode, don't forget to share it with your friends, subscribe, and I can't wait to see you next week. Happy Menopause Month, ladies.